It's always an honor when Dr. Hertog asks me to speak at one of his conferences, so I thank you for the privilege, Dr. Hertog. I've written 27 books. My name is Suzanne Summers, and I have interviewed Dr. Hertog in so many of my books because he's just a wealth of information. He asked me to talk to you today for a few minutes about testosterone and women. And at first I thought it was sort of a strange request, and then I realized that women don't think testosterone is an issue for them, but it's about balance. The body is a system, and the body wants balance. I like to do a visual. To be a man, as most of you know, is to have the ratio of testosterone to estrogen. Yes, you have estrogen. To be a woman is to have a ratio of high estrogen to low testosterone. But as we age and we decline in estrogen, as we start losing estrogen and having the symptoms of, sleepiness, sweatiness, lack of sex drive, all these things, eventually your testosterone as a woman becomes higher than your estrogen. And that's why aging women have those low voices. And there was an actress when I was a kid, her name was Lauren Bacall, and she had this real low voice. That was really that she was pretty much barren from estrogen and had way too much testosterone. Any kind of imbalance is not good. And one of the things that happens to us women as we age is when we lose our sex hormones, we can't feel sex, can't feel it. Not that we don't want it, we can't feel it unless you work with a qualified doctor who knows how, through lab work, it's individualized, it can't be guesswork, you can't just throw it at yourself or buy some over-the-counter kind of product. Through lab work, determine your exact deficiencies and put back exactly what you need and exactly the amounts that you need until you achieve harmony and balance. Once you achieve it, you can feel it inside. There's a lot of talk around America about my sex drive because I'm 74 years old and my husband and I have a robust sex life. The reason I talk about it is not to be shocking. The reason I talk about it is so others my age can realize it's not over. If you don't do anything, it'll be over. And the scientific community has so beautifully extended life extension. But no one's paid much attention except Dr. Hertog and doctors like yourselves to quality of life. I write about quality of life. Aging is about worn out parts. As the parts that wear out first are your hormones, that's the game changer, got to put those back. Then you decline in mineral balance and nutritional balance and other balance that create a lack of harmony in your body. When you put back in your individualized requirements, you get to feel like you felt when you felt your very best. So as a 74-year-old woman, I take estrogen every day of the month. I take it in a rhythm. I follow the lunar calendar. I take progesterone 15 days of the month, which is very important because estrogen is carcinogenic, but progesterone is anti-carcinogenic. I take testosterone every day because my body once poured that. I take DHEA every day, pregnenolone, and melatonin at night. I feel perfect, really perfect. And so I think that testosterone plays a vital role in women's health and women's sexuality and in your well-being going forward to have quality of life. Thanks a lot.